My name is Joshua Austin, and I'm a dentist in San Antonio, Texas. And we frequently see patients with spaces in between their front teeth. We call them a diastema. You may call it a Michael Strahan, whatever you want to call it. For some people, it can be a real problem and a real source of being self-conscious. We could do a couple of different things to fix that. One thing we could do is something like clear aligner therapy with Invisalign to close the space with clear aligners, and that can work really, really well. Sometimes teeth are too small and we need to add to them to make them wide enough to close the space. We could do that with resin composite with bonding, or we could do that with porcelain veneers with ceramics. Either one can be a good option depending on your state and your condition and what your teeth look like and how big the gap is. We can tell you more about which one is the best option for you if we have a consultation, can do a 3D scan and some photographs. We can go over all your options and give you a treatment plan that's right for you. Sometimes we see spaces form between teeth over time as we get older. The forces of our bite tend to push our teeth out sometimes, and that can cause that spacing over time. Sometimes people are born with teeth that are just too small for their mouth, and so when the teeth are aligned, they're not wide enough, and so we need to add to them to make them wide enough. Whatever the reason is, there's an option that we can do to fix it. It could be restorative with something like resin composite or something like a porcelain veneer, or it might be orthodontic with something like a clear aligner therapy like Invisalign. Any of those can work really well to treat those spaces in between your front teeth and give you a cosmetic smile that you will love. When we have a patient who has some spaces between their front teeth that are a concern, we take a lot of things into account when we try to figure out what's the best treatment for them. Sometimes it's very scientific, proportions of teeth. We measure them, height, width, and we determine how wide and how tall the teeth should be based on some of the other teeth and based on the patient's face. Sometimes it's more of an artistic interpretation of a patient's teeth. Sometimes lips go a certain way, gums go a certain way, and some of the facial features can help us determine. And sometimes it's just a matter of measuring the space, how big it is, and figuring out where the teeth really need to go within the frame of the smile in order to give us the best aesthetic outcome. No matter what, we use 3D digital technology to make all those measurements and try to determine those things and try to come up with a treatment plan that's individual based on your needs and not just a carbon copy or a rubber stamp that we do on every single person that walks in, because not everyone's teeth are the same and everyone has an individual treatment plan that's tailored specifically for them. There are many factors that go into determining how long it will take to fix a gap in between front teeth. If it is something that we can restore with cosmetic bonding, we could fix it in one day, just in a single appointment of around an hour or so. If it's a little bit more comprehensive in nature, maybe the teeth are in the wrong position, it may take several months to move them into the right position with Invisalign. If it's an issue where the teeth are worn, broken, chipped up, and altogether asymmetrical based on the patient's face, then we may look at something like porcelain veneers, which can take a couple of weeks to accomplish. But no matter what, we always try to determine what the right cause is and what the right treatment is for an individual patient so that they can make the choices that are right for them. Anytime we close spaces in between a patient's front teeth, we want to make sure it looks natural at the end. One of the first things that goes into that is determining the correct shade of the teeth. Once we determine the correct color of the teeth, we're able to pick a restorative material that matches that. And when the material matches, it becomes immediately very lifelike and very natural. Once we determine the color, then it's just a matter of determining the shape and the size of the teeth that we need to have, and then we replicate that. So that's done with a lot of different tests, a lot of different measurements that we take both in 3D scans and in the mouth. So no matter what, whether we try to do it with resin composite or porcelain veneers, we want to make sure that our patient has a natural looking outcome that looks amazing for years to come. We had a patient in just the other day, about 2 days ago, who had an old filling done on a front tooth. In addition to this old filling that was starting to yellow and break down, the tooth next to it wasn't the same shape as the other front tooth, and so it left a weird space in between her teeth. We were able to do some whitening on her teeth first, and then she came in, we removed the old filling, and then I used the BioClear method in order to build these teeth up and close the space in between her front teeth. And I remember taking her to the mirror that we have here that's got a nice light around it and having her see it for the first time and see how natural it looked and how it blended together so well. And she no longer had that space in between her front teeth. And I wish I would have been videoing it with my phone because I missed that moment of the reveal and I can't play it back. But it was such a great moment to have somebody who had this thing that was this self-consciousness, this thing that she had thought about every time she saw a picture of herself or every time she saw herself smile. And now it was gone, and it was gone in the matter of 45 minutes. It was such a great moment. And it was one that I wish I could live over and over and over again. And I just wish I would have had my phone with me when we showed her. But it was a great moment. And so I love doing things like that. I love creating those moments because it really is something when in a short period of time we can take something that someone's been self-conscious about and fix it for them. If you have spaces between your front teeth and that's something you want to fix, come in for a quick consultation. Within 30 minutes or so, we can do a 3D scan, get some radiographs, get some photographs, and we can come up with a bespoke solution, a tailored solution just for you to fix your concern and give you the natural lifelike restorations that you deserve.